Hello everyone. Can I say hi in the chat box so that I can begin the session? Actually, this is just a trial to see whether osteology works with live because I haven't done osteology yet, but I have got many requests asking for how to present a bone during viva or what are the must-know points which you should expect in a viva. So for the same reason, I thought to go live with the osteology because if I do it like the videos which I have done before, due to the distance, you may not be able to see the structures in detail. So this is just a trial. When I kept the poll, many of you mentioned about Norma Frontalis, the interior of the skull, etc., etc. I'm I know those are more important and those are more tough, but I thought of starting with a simple topic so that I will get to know whether it is useful or not. If I get more reviews saying this is useful, I'll definitely go with further sessions. Okay. Okay, so happy to see many are here to watch this live. Hi, Menti. Uh, anyway, the members stand different in the chat. Okay, let's begin today's session. Whenever you get a bone, first thing is you need to keep it in the anatomical position. That is first and foremost thing which you should know. I'll just give a briefing about the skull bone or the skull as such. The skull as such has got different views, isn't it? So this is the skull. You can look at the skull from different views. You can look at it from the front. You can look at it from the back. You can look at it from the above. You can look at it from below, and you can even look at it from the sides. So all these are important, especially when you just have a look at the skull in a radiological perspective. Okay, so all these views are very helpful if you know the details of the skull from these angles, especially when you read a radiograph. That is the first and foremost thing. Then, how to keep the skull in the anatomical position? I already mentioned whenever you keep a bone or whenever you talk about a bone, the first and foremost thing which we teachers expect from you is to keep it in the anatomical position. Suppose if you're given the skull and if you just keep the skull like this, will it look good? No. If you keep the skull like this, will it look good? No. So first and foremost thing is you have to keep the bone in the anatomical position. So when you have to keep the skull in the anatomical position, what is the plane in which you keep the skull in the anatomical position? There are different planes. The one which I would like to mention right now is Frankfurt's plane. Okay, so what do you mean by Frankfurt plane? You just keep something horizontal. Okay, horizontal plane parallel to the ground. Then you keep the skull as if the 2 points lie in this line. Which are the 2 points? Anteriorly, you have the infraorbital margin. This is the infraorbital margin. Okay, so anteriorly you have the infraorbital margin, and posteriorly you have this is the external acoustic meatus. Is it clear? Hope this is clear. This is the external acoustic meatus, the upper margin of the external acoustic meatus. Good evening, everyone. I'm not going into the chat box right now. I'll just try to finish it. So, if you keep a horizontal plane like this, the first thing, anteriorly, it should pass through the inferior orbital margin, and the posteriorly, it should pass through the upper aspect of the external acoustic meatus. It is not through the center. That line is known as Reed's plane or Reed's line. Okay, so Frankfurt's plane passes through the upper margin of the external acoustic meatus. In order to remember this, I would like to share a mnemonic. Frankfurt, F stands for fly high, isn't it? So fly high. So external acoustic meatus, upper margin, if you think about Frankfurt's plane. Reed's line, R-E-E-D. Reed's line, R stands for round. So you go for the center of the round. Okay, then it is through the center of the external acoustic meatus. So these are the two planes which we follow when you keep the skull in the anatomical position. You can just have remember these mnemonics, because even I used to get confused whether it is the Frankfurt's plane passing through the upper margin or through the center, like that. So this is the code which I used to remember. F stands for fly. So fly high means upper margin of the external acoustic meatus, and read R stands for round, and it is through the center. Hope that is clear. So that is the first and foremost thing which you should keep in mind when you keep the skull in the anatomical position. Then the next thing is when you look from the front, this is the facial skeleton, isn't it? So the facial skeleton can be divided into three parts: the upper portion, the middle portion, and lower portion by two important lines. Okay, so if you draw two imaginary lines, if you draw two imaginary lines, these two lines divide the entire facial skeleton into three regions. Okay, so you should know which are the landmarks through which these two lines pass. So I'll talk about the first line. This first line actually passes through three important points. The three important points are nothing but the points formed by the frontal bone with the articulation with the bones below. Okay, so which are the important bones with which the frontal bone articulates? From lateral to medial, let's see. This is the zygomatic bone. Then you have the frontal process of maxilla. Then you have the nasal bone. These are the three bones which will come into your immediate vicinity when you look from the anterior aspect. Okay. So which are the three suture lines? It will be easy for you. Here laterally you have the zygomatic frontal suture. Then you have the frontomaxillary suture here. You can see the frontomaxillary suture here. And between the nasal bone and frontal bone, you have the frontonasal suture. So if you keep a line like this, or if you draw, or if you connect these 3 points, this is the upper line. Okay, and what about the lower line? Lower line actually passes through the incisival ridge and the occlusal plane. That is what is actually the terms used to mark the plane in the lower part. Okay, so the incisival ridge and the occlusal plane. Occlusal plane means the plane where the two alveolar arches with the teeth meet. Okay, daily live, I'll try, but I'm not sure due to time constraints. So whenever it is possible, I will come. So these are the two planes which will divide the facial skeleton into three parts. So let's see. You have a part which is lying above this line that is actually formed just by the frontal bone. And what about the region formed just below this line? Below this line, you have just the mandible. So above this line and below this line, above this line you have just the frontal bone, and below this line you have just the mandible. In between these two lines, the middle third of the facial skeleton, you have complex bones. You have lot of bones, like you have the nasal bones, you have the maxilla, you have the zygomatic bones, all these bones which you look from the front, and if you go deeper you have many number of bones more. So this is how you divide the facial skeleton into three regions. I hope that is clear. I think I've mentioned the other normal views. This is the Norma Frontalis view. If you look from above, you call it as Norma Verticalis. If you look from the back, it is Norma Occipitalis. If you look from the lateral aspect, it is Norma Lateralis. And if you look from the inferior aspect, this is the Norma Basalis. Okay, now we are moving on to our topic proper, that is Norma Frontalis. Will it pass through, upper line passes through the nasion? So can you say, hi Indrani, can you say what do you mean by nasion? Or else I'll be talking about nasion. Hi Indrani, can you say what is nasion? Or else I will just continue with the topic. I will come to the nasion point and then I will let it be a suspense. Okay, so we'll come to the Norma Frontalis. Norma Frontalis, it's not a circle. It is somewhat oval with broader upper part and a narrow lower part. Okay, and which are the bones forming this Norma Frontalis? We have two unpaired bones, one frontal and one mandible, and we have the paired bones. Hi, Daniel, come back to you later. So in the middle, you have the paired bones. Which are the paired bones? You have the maxilla. These are the two paired maxilla. Then you have the two zygomatic. Yeah, you replied. I know. I'll tell you later. So two maxilla, then you have the two zygomatic bone, and then you have the two nasal bones. So these are the three paired set of bones, and the unpaired are the frontal bone and the mandible. Okay, this is how you get the bones in the Norma Frontalis view. Now let's talk about the sutures which you see from the Norma Frontalis view, because this is how we examiners usually ask the students, because we won't get time for to let you say the entire Norma Frontalis. Okay, so when you get the Norma Frontalis, we will just say how it is divided, how the facial skeleton is divided from the anterior aspect, or what are the sutures you expect, what are the points through which these two lines pass. Like that, you will get questions. So I'm hi Soumya again. So I'm just trying to explain as if we expect from you during Viva. Okay, so now let's talk about the suture lines. So suture lines, when we talk, first we need to talk about the frontal bone and the sutures made by the frontal bone. Already we have mentioned all the sutures made by the frontal bone. First, with the zygomatic bone, you have the frontozygomatic suture. Then with the maxilla, you have the frontomaxillary suture. And with the nasal bone, you have the frontonasal suture. So these are the sutures formed by the frontal bone. Then coming to the midline, you have the two nasal bones, and in the midline, you have the internasal suture between the two nasal bones. Okay. Then coming again below, you have the maxilla and zygomatic bone, isn't it? So maxilla and zygomatic bone. So between the maxilla and zygomatic bone, you have the zygomatico-maxillary suture. Then again, if you come below, you have the two maxilla. In the midline, again, you have the intermaxillary suture. So these are the most important suture lines which you should be knowing in a Norma Frontalis view. Okay, so the three suture lines with the frontal bone, between the two nasal bones, internasal suture, between the maxilla and zygomatic bone, the zygomatic-maxillary suture, then between the two maxilla, you have the intermaxillary suture. So out of these three suture, out of all these suture lines, you have two suture lines lying in the midline. They are the internasal suture and intermaxillary suture. So these are about the suture lines. Now coming to the features, you have three large openings in the Norma Frontalis view. One is the nasal aperture, and the other you have the two orbital openings. Okay, so the nasal aperture as well as two orbital openings. So these are the three important apertures which you have to talk about in Norma Frontalis. Of course, you have the oral cavity, but since it is closed, we are not talking much about the oral cavity, but we will talk about the nasal aperture and the two orbital openings. So when you talk about the nasal aperture, this is otherwise known as anterior nasal aperture. It is what about the shape of it? It is roughly pyriform in shape. Okay, broader base and narrow apex. So it is roughly pyriform in shape, and there are two important points above and below this nasal aperture. Below this tip of the intermaxillary suture, this is known as the anterior nasal spine. Okay, the tip of the intermaxillary suture, you call it as anterior nasal spine. And the lower portion of the internasal suture, you call this as rhinion. R-H-I-N-O-N, rhinion. R-H-I-N-I-O-N, rhinion. So it is the lower part of the internasal suture. The upper part of the intermaxillary suture, you call it as anterior nasal spine. So where is nasion? Nasion is the upper part of internasal suture. So actually, it is the junction of the frontonasal suture and internasal suture. If you draw a T here, this is the horizontal part of T is frontonasal suture, and the vertical limb of T is internasal suture. So the meeting point of these two is known as nasion. And as Indrani has said, that line is also passing through the first line, which we have already mentioned, is passing through the nasion. The lower part of the internasal suture is known as rhinion, and the upper part of intermaxillary suture is known as anterior nasal spine. And on either side of the anterior nasal aperture, you can see a notch. Can you see? These notches are known as the nasal notches of the maxilla. So these are the boundaries of the anterior nasal aperture. Now coming to the orbital opening. The details of the orbit as such, I will deal in another session. If you find this type of osteology sessions useful, then I will do more and more sessions. This is just a trial run. Please let me know whether it is useful. Okay. So this is the orbital margin, orbital opening. So when you look at the orbital opening, you can see that there is a superior margin, otherwise known as supraorbital margin. There is an inferior margin known as infraorbital margin. There is a lateral margin and a medial margin. So these are the margins which you need to explain now. So what about the supraorbital margin? Supraorbital margin is just formed by one single bone, that is the frontal bone. Okay, that is the supraorbital margin. And the junction of the medial one-third and lateral two-third of this supraorbital margin. When you just have a look at the supraorbital margin, you can see that the medial margin is roughly rounded and lateral margin is very sharp, isn't it? So medial one-third is rounded and lateral two-third is sharp. The meeting point of these two portions, there you can see a depression that is known as supraorbital notch, and you will get a foramen there that is known as supraorbital foramen. And what passes through the supraorbital foramen? You have the supraorbital nerves and vessels. Okay. Now coming to the infraorbital margin. Infraorbital margin is formed by two bones. Which are the two bones forming the infraorbital margin? Medially you have the maxilla and laterally you have the zygomatic bone. So these are the two bones forming the infraorbital margin. Maxilla, zygomatic bone. Then what about the lateral margin? Lateral margin, you have two bones forming. One is a portion of the frontal bone coming down, and from below you have the portion of the zygomatic bone going up. So it is the zygomatic process of frontal bone coming down, and it is the frontal process of zygomatic bone going up. So these two bones will be forming the lateral margin. And what about the medial margin? This is the medial margin, right? So this medial margin is actually formed by the frontal bone as well as you can see the prolongation of the maxilla upwards. This is actually the frontal process of maxilla. And this sharp margin formed by the frontal process of maxilla is actually the lacrimal crest. Okay, so the lacrimal crest of the frontal process of maxilla and the frontal bone forms the medial margin of the orbit. So these are the margins of the orbital opening. Now so we discussed about the three openings, one anterior nasal aperture and the two orbital openings. Now we will see some of the features of each individual bones. First we will start with the frontal bone. What about the frontal bone? If you look at the ridge above the orbital margin, supraorbital margin, you can see a raised elevation on either side, isn't it? So these are known as superciliary arch. Can you see this elevation? This is known as superciliary arch. And when you trace it towards the midline, you can see again an elevation somewhere here, just above the nasal bone. That elevation is known as glabella. Okay, and we have already mentioned about nasion, the junction between the internasal suture and the frontonasal suture, that is known as nasion. Then anything else for the frontal bone? Yes, you can see two prominences on either side. They are known as frontal eminence. So these terms are frequently asked whenever you sit for a viva. Okay, superciliary arch, what do you mean by glabella? What do you mean by nasion? What do you mean by frontal eminence? You should be able to spot all these things. Now coming to the maxilla. What are the features of the maxilla? First and foremost thing is the infraorbital foramen. Roughly 1 centimeter below the infraorbital margin, you have the infraorbital foramen. These foramina transmits infraorbital nerves and vessels. Okay, so this is the infraorbital foramen. And coming to the alveolar part, just above the incisors, there is a depression that is known as incisive fossa. If you get a better skull, you can see it very clearly. Mine is a little bit distorted here. Okay, so just above the incisors, you have the incisive fossa. Then you just look for the canine fossa. This is the canine fossa. Sorry, the socket for the canine tooth. So it creates an elevation here. Okay, this is known as canine eminence. So this is immediately you have the incisive fossa, then you have the canine tooth, if you have a canine tooth for your skull. So that will create an elevation that is known as canine eminence, and just lateral to it, you have canine fossa. So from medial to lateral, incisive fossa above incisors, canine eminence caused by the canine tooth, and laterally you have the canine fossa. Then there will be the frontal process of maxilla, which we have already mentioned. Can you see the two bones between which this frontal process of maxilla lie? This is actually lying between the nasal bone anteriorly and the lacrimal bone posteriorly. Nasal bone anteriorly and lacrimal bone posteriorly. Between these two, you have the frontal process of maxilla. Then you have the zygomatic process of maxilla, where you have the zygomatico-maxillary suture, and then you have the alveolar process of maxilla, where you have the teeth arranged. Okay, so that's about maxilla. Then which are the bone you have remaining? We have the zygomatic bone and mandible. For the zygomatic bone, we have not much to tell about, but there is a foramen here in the zygomatic bone. Okay, so this foramen is known as zygomatico-facial foramen, which transmits zygomatico-facial nerve. Okay, so this is known as zygomatico-facial foramen. Ethmoid bone, it's not coming in the purview of the Norma Frontalis. They are deeply seated. Okay, so normally we talk about these important bones when we say or mention about Norma Frontalis. So that's about zygomatic bone. And the last part is the uh, mandible. So I'm just holding back the remaining portion because it's too heavy to hold the entire skull. Okay. So now we'll talk about the features of the mandible, which you can see in the Norma Frontalis view. So which are the features? The two halves of the mandible will be fused in the midline, and it will be seen as a faint ridge in the midline. That is known as symphysis menti. And when you look closer, you can see a triangular elevation. Can you see a triangular elevation? So this triangular elevation is known as mental protuberance. Mental protuberance with the apex above and the base below. And the two ends of this base, you can feel a tubercle that they are known as mental tubercles. Okay, so mental protuberance, a triangular elevation with the apex above and base below. At the angles of the base, you have mental tubercles. Hope that is clear. Then you have a mental foramen. On either side, you have a mental foramen, which transmits mental nerves and vessels. Well, the next thing which we examiners love to ask is, what is the location of this mental foramen? It is located against the second premolar, or you can say at the junction of the first and second premolar. Okay, either against the second premolar or at the junction of the first and second premolar. That is the point where you have to look for mental foramen. Then the next thing is this fossa just below the incisors, just like we have discussed in the maxilla. This is known as incisive fossa. And one more point which you can make out in the normal frontal view for the mandible is you can see an oblique line. Can you see an oblique line? This is actually the continuation of the ramus of the mandible. So this is known as the oblique line. Okay, that is just the continuation of the anterior border of the ramus of mandible onto the body. And the junction between, this is the ramus and this is the body, right? The junction between the ramus and body of the mandible, you have two important structures lying. They are the facial artery and facial vein. Facial artery will be lying anterior and facial vein will be lying posterior. That is at the junction of the ramus and body of the mandible. So these are some of the important features which you can make out in the norma frontal view, norma frontalis for the mandible. Okay, so they are the external features. And one more point I would like to say is, if you keep the skull like this, if you draw a line just lateral to the midline, say somewhat 3 centimeters away from the midline, these 3 points, say from above, you have the supraorbital foramen, then you have the infraorbital foramen, and you have the mental foramen. All these 3 will be lying in a same plane or same line. Okay, so just to note these 3 points, I just added that point. Now, whenever you start with a bone, always be ready with at least 2 or 3 applied aspects, because sometimes we Just ask a blank question like, can you say some applied aspects for this bone? Like that. So you should be prepared with 2 or 3 applied points. So the first thing is, uh, when the frontal bone forms, there will be a suture line in the middle, and usually it gets obliterated. Sometimes it will be seen along the lower aspect of the frontal bone, and that is known as metopic suture. Metopic suture. Okay, so metopic suture, the importance of this metopic suture is it can be sometimes mistaken as a fracture line. When you take an X-ray of the skull after road traffic accident also. So you need to expect this as a normal variant. Then we mentioned about the supraorbital notch, supraorbital foramen, the supraorbital nerves. The importance of this is when you squeeze at this region like this, you will be squeezing around the supraorbital nerve, and what happens is you will be experiencing severe pain. And this is one of the techniques used by the anesthetist to know the depth of the anesthesia. Because even if you are malingering, if you squeeze at this region, you will wince with pain. Okay, so that is again another applied aspect. Then about the nasal bridge formed by the nasal bones. There are many proverbs in your colloquial languages. If you get a blow from front or if you get a blow from side, this nasal bridge will collapse or get depressed or get deviated or whatsoever. Then about the fractures which you get for the facial skeleton, they are together known as Layford fracture. Layford, you might have heard about Layford fracture. You can get a short on Layford fracture as well. I prefer to draw a diagram and show it to you. So sometimes I will use chalk and board and do a separate session on Layford fracture because it's again a favorite question. So there are 3 planes through which you explain the Layford fracture. So please read about Layford fracture. I will do a session later on the Layford fracture. Okay. So this is about the Norma Frontalis in a nutshell. Hope the session was useful to you. Please let me know whether osteology live sessions are useful. If it is useful, I will try with some of the bones which are important. Hope you could see the bone clearly. Please let me know your comments. According to that, I will definitely continue with the sessions. Okay, so thank you. Thanks for watching. A very hi to all. Please explain locations of lobes of brain. Yeah, I will do it with the help of diagram. Yeah, I think most of you liked the session. So according to your review, I will decide whether to have further sessions. Okay. So thank you. Thanks for watching. Have a great day. Good night. And those who haven't subscribed yet, please do subscribe. Because whenever I put a video, I expect more subscribers or more viewers or something of that kind so that I will feel motivated to do more videos. So if the views go down, if the subscribers go down, then automatically we will also go down and we won't feel like uh, taking sessions. Okay, so please do encourage so that I will be doing many more sessions in future. And it was wonderful. I look forward. Hi, Samriddhi. Hi. A very hi to everyone. I'm not getting time to read all the names. So have a great day. Good night.